I make my own like bias tape, and sometimes I just use it. I just brought a couple of them. We're not Mennonite, but we went to a Mennonite college. It's Mennonite religion. There's no proselytizing. It's all, and they use the same size for an education kit, sewing kit, like where they put straight pins and scissors and things, hygiene kits. They even make usable sanitary napkins for the women, which I think is awesome because
we're watching a
women
5-year-old and a
3-year-old just sit at home on hardcore if they're having their periods
Reid
because they don't have
watching
any.
them now. I made her get up.
I can get them for you. Okay. Okay. Yeah.
They're cutting those up to make.
Oh, it didn't go on.
I missed the big dinner there because I was in St. Thomas.
Stick a hole in them and tie them on a string. So that was their project this year.
I almost came back.
I have a whole list of things, but they want to sew.
Well,
So
everybody wanted
Isn't
that
that
week.
amazing?
Instead.
Somebody was
I wanted the other week.
sewing machines.
I wasn't going to cancel.
It's a 38-inch piece of fabric. You just, I mean, there's no seam here. You're just folding it. So yeah, I'll get that for you. And if you make any of these, I'd be glad to take them to Goshen.
Right now. You are? You are? Or you? I am right now. Till March. For my chemo and all the other good stuff. So. Somebody said, "Oh, where are you going?" It's like,
anyway,
let's go.
show and tell for you. Yeah.
Rita goes in next month for pet scan.
Yeah, I just started doing
they keep track of it. So that's good.
Man,
So that's great that she's getting along well. And
spinning or whatever.
Yeah.
It was like
mindless but productive.
then she fell and broke her arm.
well, and our kids look like
So
these.
we have
go see
we
the
have the
kids
two
and
little kids and she has a broken arm. So
oh gosh.
she heard one of the kids crying and she tried to get out of bed too fast and flipped it. It's not even a good story. Well,
She doesn't look very awake.
unfortunately, to hear that.
But then neither do the rest of us. So.
Oh, we're almost there. Did you see I did my genetic profile?
It doesn't come directly to me, but when I go into your chart, I'll be able
I
to see
found
it.
out I'm like average.
Yeah.
I knew that, but
Average is good.
it's 7 o'clock, so we'll call the meeting to order. Was that hi? We have to announce each of our names, and so can we start at this end?
Carrie Crawford.
Grace Lauder.
Amy Sadler.
Mike Mawhorter.
Bob Sausaman.
Russ Gilliom. Thank you. So now you all know us. First thing is the approval of the minutes. And is there any discussion or motions?
I'll make a motion to approve them.
Second. Okay. Any other comments or all approved? All in favor of the motion, say aye.
Aye.
All opposed? Well, the minutes are approved. Any old business, Scott?
No old business.
Okay. Well, now what everyone's been waiting for, we need to vote for new health board chairman and vice chairman. So it's everybody's chance to move up in the world. And so, do we have any motions?
I'd like to nominate Mike Mawhorter to remain as the chairperson.
I'll second that.
Okay.
Does he accept that?
Yeah, it's any other discussion with that? All in favor, say aye.
Aye.
Opposed? Okay, well then I'll do another year, I guess. And vice chairman. I think our old vice chairman is Dr. Lieb, and he's not here, so you can vote him right back in.
I'm not gonna ask on that.
That's the way it works around here.
Any discussions or motions on that?
I'll nominate,
Dr. Lee.
Lieb.
I'll second.
Okay. All in favor?
Aye.
Opposed? Well, that was quick. We're all set with that. Yeah. So, I don't see other new business. Well, right to the reports. This is Dr. Burkett.
Guess I get over here where I want to, don't I? As you can see with the other reports, it's been another busy quarter. They're finishing out the year with HFI funding, and of course they reshuffled things so that the Bowen Center had to give money back to us, so we got 50,000,
Almost 50,000 back.
almost 50,000 back from them, and now the multi-clinic or the free clinic has given money back as well because they didn't spend it on what it was designed for. So we got about 70,000 back from them, which doesn't make any sense to me, but anyway, so that's been a really busy time for Scott to try and reshuffle everything and give out less money, but still to some very deserving partners. And if you were there at the meeting when the state came back in October, you heard some of the really neat things that have been done with that money. So the partners have all been very happy for the money and have used it well. Otherwise, as you can see in the reports, it's everybody's been busy doing their normal things, and of course Darcy's always got way more things than she could possibly do, but wants more. We're happy to have Emily Banks with us in her second week now. That was kind of a question as to whether the American Heart Association was going to have money for the position, but they finally came through, and happy to have her with us, and I think she's ready to hit the ground running, so that's great. Otherwise, I don't really have a lot of new things to report. We're back into the wonderful flu season, as you know, and I think I saw in the news there have been like 32 pediatric deaths across the country. And if I understood it right, I think 100% of them had not had the vaccine. And so, again, they report that vaccines, 40% effective as usual. But at least if you've had it, it seems like you're less likely to end up in the hospital or die. So I don't think there are a lot of new things. COVID still around, but I notice I get a report from one of the state infectious disease people every week, and they've actually taken COVID off of that weekly report now, which I don't understand. At least this was like for the first week, so maybe it'll show up on next week's. The only reported infectious disease that we had from the first week of 2026 was a case of gonorrhea. And that's great to have in Whitley County, but anyway, so hopefully it'll be a busy but reasonably normal, if there is such a thing, flu season, respiratory disease season. Otherwise, any questions? Okay, I'll let the rest of them explain what they've been up to.
Thank you. Up to Heather.
Okay, good morning, everybody. So for the quarter, October 18th through the end of the year, this is what we're reporting on now. We did have one COVID death. So for the year 2025, that made our third person pass away from COVID. I did have another Class B person, which is an immigrant, come to the United States, and I'm required to follow them and make sure they do what they're supposed to, which is when they come to Indiana, Whitley County, they're required to get a chest x-ray and a blood test to make sure they don't have tuberculosis. That person came from Albania. And then I continue to follow the children with high lead levels. And we have 5 kids monitoring that are over 5, which is the required home visit, blood level case. I did order 100 more doses of Narcan, and the sheriff's department came yesterday and they got 48 doses. So we supply the police department, the sheriff's department, the schools. And that's it for my report. Any questions?
Thank you, Heather.
You're welcome.
On to Traci.
It's been a busy year so far. I have 7 new places coming, and other than that, I've been finishing up my year-end renewals and passing upcoming conferences.
What's the deal with Crossroads? It's a truck stop.
Yeah, it's going to be.
So they're gonna have food and
They're going
stuff.
to tear it down and
Redo the whole.
Some dedicated.
Well, I've heard rumors of it, but I never knew if it was gonna happen, so. Any questions for her? Thank you. So to April.
Nothing really new to add to my report. Vaccines are slow right now. I did finish my QPR certification last week, so I can teach suicide prevention with Darcy. I'm following out at the Work Release Center for a little bit for peer recovery coaching. So the people that are leaving there, that are in that program, once they leave the Work Release Center, they'll have another option to reach out to somebody after they're out. So I've been following Sierra from Allendale Treatment, just kind of getting a feel for how she runs that out there. And nothing else.
It's a quick day. We're gonna have to slow down a little. Scott.
So not much going on environmentally wise. Obviously, it's very cold outside, so there's not a lot going on out there. Still a lot to finish up from last year that they didn't get done, which was surprising because we had a very dry year. You took it for granted. Biggest thing on the horizon is the budget will be coming up. As you might have heard, in 25, the HB1 from the state's a big issue, and supposedly a lot of money would be gone from the counties. So we're waiting to see if we get any direction on budget and what that will look like. Luckily, like Dr. Burkett had said, we have money that's come back to us that will help. We can help with salaries. So we don't know what 27 is going to look like at all for budget. So it'll be interesting. But the April meeting we'll be talking about budgets again. I've had a couple interesting house visits with the sheriff's department. Some arrests, some people being held in handcuffs, and drugs and pit bulls and crazy people. Yeah, it's been an interesting January.
I don't miss pit bulls, so.
They just seemed angry. They didn't bite anybody.
Yeah. Any questions for Scott? Thank you. Danielle?
We have more human milk donations, so we're up to 12,252 ounces, which is nice. It was a quarter of meetings. I went to a lot of them. The Nanilka, my lactation consultant meeting, the Indiana Obesity and Chronic Disease Prevention and Stakeholder meeting, the National Association of County and City Health Officials call for strengthening breastfeeding initiatives, which is just going to be kind of a community thing. How can we strengthen our breastfeeding support in Indiana? And then I attended the Postpartum Support International Advanced Training in November. So the plan is to take the test sometime in the next few months, but I'm old. I told Scott I passed testing, but it's okay. I can do it.
She's old. Yeah.
Any other questions for Danielle? Well, thank you very much. Darcy?
Well, and I don't have a lot more to add. I think the highlights that I would like to point out, April and I teamed up with Babe and did a car seat safety check one afternoon. We had over 30 car seats that were checked, which is pretty incredible. And then we did launch NeighborLink. I don't think I put that on my list. So Sonia, Rubright, and I teamed up and got that going. So that pairs individuals that need maybe their light bulbs changed or a door widened or just a home repair with volunteers in the county. So we launched that. I've been working with Parkview, Francine's Friends. We have 13 sites for the mobile unit this coming year. And then we're also working with the Council on Aging on a huge county resource fair. And that'll be August 1st out at Indian Springs Middle School. So those are the things we're looking at.
Looked like you were busy. Any questions for Darcy? Thank you.
And Emily, we're just thrilled to have her. So
I'm sure she'll be busy. Laura.
Not much to add other than we did have 5 home births. We do have 2 cases pending yet where parents want their birth noted for Whitley County, but they were noted in Allen. One was a birth that was on the highway, and so then they drove on to Allen County, so the birth was registered in Allen County, but the parents are trying to fight to get it in Whitley County because that's where they say they were. The other one, I would never want to own an Airbnb because this person rented an Airbnb in Whitley County to have her home birth. So she was closer to her midwife, but the midwife registered it at her actual residence, which was in a different county, and she's fighting to get it to be brought into Whitley County. So home births have made...
Why does it matter?
It doesn't.
Okay.
It's just the parents.
Making sure
they're registered. Okay. It's done. They've got their social security. It's all just the parents. And so therefore it just ties in my hands. I sent it to the state. I don't know what I'm supposed to do with it. Then you do see the totals for death. We did have a number of suicides this year. They were not young people. They were all older people. And then, of course, cancer continues to be an issue. The report that Heather gave with a total of 3 Whitley County residents, only 1 was recorded in my death system because the others happened in Allen County but were Whitley County people. So the as you could read down below, there have been some changes to the amendment process in birth certificates, which just really will take some of it out of our hands. They've also made just recently a change to burial transit permits. That's been a big issue with the coroners and with the funeral homes because there's still legislation that they have to have this paperwork with them. There's it's a tri-form. One form comes to me, one form stays with the body, and one form is for their records, and the state just decided they're not going to provide it anymore. Their thought when they developed drives was it could just be started in drives, even though the legislation says it has to be a physical 3-part form. So we will have to pick up that expense. I did call around to all our funeral homes. We've changed it to a 2 because the pink one really was not going anywhere. The nursing homes are faxing me theirs, so they're not, and then they're mailing it too, so it's just going to keep them from having to have that expense. The coroner does bring me the pink one, but they said they could just make me a copy or when I get the white one. So we'll see how that works, but that's going to cause chaos throughout the county because the state's not giving a lot of guidance. They sent on a form with no numbering system, but said we were still supposed to track them, and lovely. That is it.
Any questions for Laura? Thank you, Laura. Any other business or anything that anybody has? Or?
I've got some good news.
What's that?
Okay, so this was pretty interesting. There's a 30% decrease this past year in drug overdose deaths, which is great. And that's a lot of it is controlling the border more, so we just have the open border with all this trafficking coming through. So I think that's real good. And then Secretary Kennedy is making some good improvements on this Make America Healthy Again with some of the things initiatives that he has in his group and Darcy and I have talked about this as far as dietary and some of the other ones. And then a book that I had just gotten done reading, and the copies over here if anybody's interested in it. It's kind of an expose on big pharma, the government, and other agencies that kind of colluded together, and money's a big part of this, to promote some of their products, and at the expense of the citizenry. And it was just disturbing to see how much money was being exchanged, and I look at it as kind of a bribe. But anyhow, it's kind of an interesting book to look at the inner workings and machinery of that kind of a collusion between the CDC and other agencies and the pharmaceutical companies. So anyhow, I was excited about that decrease in the drug deaths, and I've been working with people in Fort Wayne on this over several years, and that's always a big challenge over there. And we reflect about 10% of whatever's going on in Allen County. So.
Well, good. Thank you. Anything else? Well, do we have a motion to adjourn? Do we have a second?
Second.
All in favor, say aye.
Aye.
Opposed? We're adjourned. Thank you.
Very good.